Hi, I'm Perez McAdoo, and I want to spend the next few minutes to talk about what I've experienced over the last 10 years and how it has given me a glimpse of how interconnected communities will transform the health and prosperity of youth in the most vulnerable communities. I'm an obstetrician gynecologist. In my personal statement for residency, I wrote that becoming an OBGYN was simply what I love and who I am. So you can imagine how shocking it was for me to realize that after numerous years of education and training, I still was not improving the health of my patients. This was just a little bothersome to me, but I would also guess that it would be even more bothersome to my patients. At this point, I became frustrated and a bit impatient. No, some would say very impatient. My sense of exasperation was due to the fact that most of my patients were teen girls experiencing a disproportionately high rate of teen births, not just over 1 year, over several decades. When I started my work in adolescent sexual health in 2005, Massachusetts had one of the lowest teen birth rate in the nation. But not all communities in Massachusetts were faring as well. In my county, the teen birth rate in one city was 3 times higher than the state average. In another city in our county, the teen birth rate was 5 times higher than the state average. In addition, both cities had teen birth rates above the national average. To me, this seemed unjust, especially since my patients live in vulnerable communities with high rates of poverty, unemployment, and low graduation rates. As an OBGYN, I often heard what others thought about teen pregnancy. That's what they do. It's in their culture. That's never going to change. The words would take up so much space in my mind, but not really make any sense. The words now elicited a visceral response from me. My personal connection, I realized, was rooted in a much deeper personal experience. Approximately 7 to 8 months pregnant, I started interviews for a residency program to train in obstetrics and gynecology. I was prepared for the unavoidable questions I would be asked about my pregnancy and how I would face a grueling residency with a new baby. No problem, got it covered. I planned for this too. Pretty well prepared, I entered into an interview. The initial questions were as I expected. I was feeling pretty well at ease. But that quickly changed when he asked me if my pregnancy was planned. He had no idea. His question exploded in my mind. At that moment, I was stripped of my education, my ambitions, and my drive to succeed against all odds. How do I answer that question? I could say, for the first 6 years of my life, I lived with my grandmother in a house with no indoor plumbing, no electricity, and not one children's book. I have been working since the age of 8. I learned very early on what a 10-hour workday is like. Then with my uncle, I would walk up 17 flights of stairs in the projects because someone urinated in the elevator and the light was broken. No matter what did not seem right, I still became everything no one expected me to become. Not even myself. But that was not what I said. I could not find the words to respond to that. Years later, as my work pulled me in the direction of teen sexual health, I thought about that interview again. If this is how an educated adult was treated, then how are my young patients treated when they are judged about their reproductive choices? That question would impact my decision to leave my clinical practice. At the end, I knew in my heart I was not leaving medicine. I was just going to do it differently. I began to meet with a young parent support group at a vocational high school. There, I learned everything I needed to know. The teens broke it down for me. After about 10 weeks, I realized my approach to teen sexual health was incomplete. I began to seriously doubt that focusing heavily on contraceptives would transform the sexual health of teens. I learned that in vulnerable communities, teen pregnancy is not just about health. Teen pregnancy is about the future prosperity of the teen, the child, their family, and the entire community. With this understanding, our approach to teen pregnancy prevention started to change. We embedded teen pregnancy prevention strategies within the context of their educational goals. We worked with community partners to link teens to resources they needed to succeed in school, work, and home. We pooled our human capital to make it happen. I was inspired that our strategy appeared to be working, but we had no resources to capture the data that would tell us for sure the impact of the work. A few years later, I came across a report by the Massachusetts Department of Public Health on the impact of school-based health centers. One of the pages of the report described services for parenting teens. One statement caught my attention. The number of graduating parenting teens has tripled at Putnam Vocational Technical High School since the start of the teen parenting program. My eyes were transfixed on the first 8 words of the sentence. I thought there is a real possibility that an interconnected, community-based approach may really be the way to improve the sexual health of teens. A grant opportunity opened the door for a bigger vision, one that would move a small idea in one school to become the pilot for a citywide model of care for parenting teens. In a city known for fierce competition for grant dollars, it was very surprising when approximately 21 organizations contributed to a common vision of an integrated, collaborative, coordinated case management services for parenting teens. Imagine teen parents entering into one coordinated system of care, not within a hospital, but across an entire city. We continue to think big. Now, multiple community partners from different domains across the county work together using community-based approach to reduce teen pregnancy. Another grant opportunity acted as a catalyst, providing additional resources to the community partners. The goal of this grant is to reduce the teen birth rate by 10% in 5 years. We threw ourselves into it. Hopes, dreams, blood, sweat, tears, and sleepless nights. We were determined to reduce teen birth, not because controlling fertility was the objective, but because through our collective action, we agreed that we must do better and give all teens the opportunity to succeed. So after a few years of intense collaboration, we found out what kind of impact we had. According to the Massachusetts Birth Report, between 2010 and 2012, the teen birth rate dropped in one city in our county by 14%. The decline surpassed the grant goals in the first 2 years of a 5-year project. But this did not blow me away because the average decline across the state was 18%. But what I read next was astonishing. The other city in our county, which has the highest teen birth rate in the state for over a decade and received the least resources, dropped its teen birth rate by 32% in 2 years. The teen birth rates in both cities were at the lowest level on record. If you look at the data in isolation, most say it looks pretty good. But if you understand community context, and I don't mean just the conditions of poverty, unemployment, and graduation rates, if in addition to that, you understand that in these vulnerable communities, there is a large nonprofit sector with many competing players going for the little resources, then you would see how big the data really is. The drop would not have happened without youth leadership, social service providers, parents, educators, medical providers, city officials, and other caring adults working in concert to make it happen. These were partnerships not in name only, but in deep interconnected relationships embedded in a foundation of respect, trust, and transparency. A former teen mother who is a powerhouse in adolescent sexual health questions if maybe, just maybe, these interconnected relationships are the secret sauce needed to transform teen pregnancy. Now, the question became, how do we sustain the collaborative work? But here is the problem. Many of our community partners have been involved in previous collaborations that start off strong and then fizzle over time. Sustaining the work seems too big of an idea, especially when funding is about to end. But I wasn't worried about money. I believe the positive data is telling us that interconnectedness is the glue that holds the collaboration together. It is not bigger programs, not bigger budgets, or bigger organizations. Interconnectedness is the key to sustainability. While visiting family in Orlando, Florida, I shared my work with my cousin. She then simply stated, "Sarah, your first community is your family." Growing up, our extended family, a series of 4 interconnected nuclear families, were not more than about 20 minutes away from each other. The interconnectedness of our nuclear families built the foundation of a larger pool of human capital and opportunities that some members of our nuclear families may not have had access to. A few years after becoming a single mother, my mom moved my brother and I into a two-family house. My mom did not purchase the house for the rental income. Instead, she purchased that home so her sister's boys could benefit from a better neighborhood with better schools that would increase their likelihood of success. As I drove back to my hotel, I thought deeply about my cousin's comment. I looked around and took in the landscape of Orlando. I started to see Disney differently. For the first time, the concept of a big, strategic master plan did not seem like child's play. Whether small or large scale, the interconnected areas in the amusement parks are strategically located to maximize our experience and increase our happiness factor. But it was not Disney that captured my imagination, but this story did. In the late 1980s, Central Florida experienced a series of winters with freezing temperatures that decimated their citrus crops and wiped out the industry. They estimate the freezes killed 1/3 of the commercial crops, estimated at $2 billion. The option to regrow their crops did not exist. It turns out the citrus trees take a long time to grow, so the land would not be ready to produce new crops anytime soon. The landowners had to find an alternative way to make their land profitable. In a restaurant in Winter Garden, Florida, the landowners made a decision that is now transforming the landscape of West Orange County. Instead of just selling off their properties to whomever, the landowners decided to collaborate on one common strategy: to create the largest master plan community in the history of the region. Their vision was a series of interconnected villages with access to resources people need in close proximity to where they live, work, and play. I became fascinated by the potential of a master plan. I can see how it would maximize my happiness factor if I can easily navigate my environment and have easy access to the things I need to help me live a better life. In my mind, I began to overlay the concept of master planning over our work in teen pregnancy. I envisioned a series of interconnected services and partnerships to address teen pregnancy within a neighborhood. Now, I can see the potential for sustainability and transformation. If we structure the resources teens need to improve their health in a way that maximizes easy access to these resources, then by default, teens will begin to make healthier choices and increase the likelihood of a prosperous future. So imagine, in a teen's neighborhood, he leaves home to go to school. Then after school, he participates at a youth center linked to community resources in education, health, work, and other community assets. Imagine a variation of these small clusters replicated in various communities. The series of clusters would become an interconnected network of coordinated services for youth across an entire city. So no matter where the teen moves throughout the city, the message is consistent from home to school to work to play and back home again. But it gets better. Imagine doing this in communities where all partners purposely take a disciplined approach to reach this common goal using common strategies, ultimately creating an interconnectedness that's built on mutual respect, trust, and transparency. This is what I call an intentional community. This is the secret sauce in a master plan for teen pregnancy prevention. But I can see the possibilities even beyond teen pregnancy. I can imagine how an intentional community would also lead to reductions in youth violence, substance abuse, and potentially improve education outcomes. Now, as a public health physician, my experience tells me this idea is truly possible. Because when I close my eyes, I see all the pieces of this idea colliding together and creating art. Like a symphony where the strengths of each instrument come together in a unified melody, powerful and awesome. The music sounds like pure magic. I have never been to a big symphony, but I can only imagine that it would feel this beautiful.